You're listening to the La Jolla Cosmetic Podcast with Monique Ramsey.
You've read the pre-op packet and you've stocked your fridge with protein shakes and cleared your calendar. But what if I told you there are a few surprising things that could make or break your plastic surgery recovery, like keeping your dog or cat out of the room? Joining me today is Kayla, our clinic manager and lead nurse for Dr. Swiston, and she's going to help me dive into the things that you may not know about plastic surgery recovery, the small stuff that makes a big difference. Welcome, Kayla.
Hi, thanks for having me again.
Oh, thanks for coming. So, what inspired this episode was, I have a friend who's thinking about surgery, and we started talking. And I said, "Oh, you can stay at my house. And if I'm gone, you can take care of my cats." And Ruthie, our coordinator, is like, maybe not. And I was like, what? What are you talking about? Well, so that's what inspired this episode. And I remember from what was it, like 2018, there's a story about a man who lost all four of his limbs and most of his nose from a bacteria from his dog kissing him. So,
Mhm.
what's that about?
Yeah, so he contracted a bacteria after the lick from the dog's saliva. He was in the hospital, he lost his limbs. And it's tragic because you are parents to these animals and you think just a simple kiss is going to be a simple kiss, and then down the road it could be this. And so at least the doctor said that he was very positive, and as soon as he got home he cuddled with his dog, but hopefully no more licks. It's just a tragic story.
Yeah, and it's super rare that this would happen, but, it was, I guess, a pretty, um, what's the word? Just like a common mouth bacteria in animals. So it
Mhm.
wasn't like the dog had some strange disease and then one thing led to another. And,
Mhm.
and it was funny because the articles were like, "And he kept the dog." I'm like, "Of course you keep the dog."
Mhm.
Like,
Yeah, we're
just
in this
because
together.
yeah, yeah, which I thought was weird, but we'll put a link to the article in the show notes and then you can look it up he's on different videos and stuff, but it's just really tragic. And so when that happened, that led to us changing our protocol about animals. So, and that's not super obvious. And I forgot all about it. And I didn't realize we even changed our protocol. I just remember the story. And so, why do we want to keep our furry friends at a distance? And what do we recommend in terms of what are okay things and what are not okay things with the animals?
Yeah, so I always ask patients like if they have pets at home, and you just never assume a cat or dog. You don't really know. I mean, you can have any sort of animal these days. So I always ask, do you have pets in the home? And they'll, let me know they have a cat, dog, bird, rabbit, whatever. But it is so important to keep the sheets clean. So I tell patients like, don't wash them once, maybe wash them twice because the fur you
Oh,
have incisions that just take a couple weeks to really seal and heal, and of course, we have steri-strips covering the incisions, but sometimes those steri-strips get wet, and sometimes they can fall off and be exposed. And although we're monitoring our patients closely, I really do think it's important for patients to make sure that their sheets are clean, that the clothes that they're going to be wearing, especially early on out of surgery, that they don't have any fur on them, that they have guests to come in or someone to help kind of walk the dog or change the litter box. You just don't want to run the risk of any bacteria associated or coming near to the incisions, and anything fresh from surgery.
and is it kind of the same advice for dog owners or cat owners? Like, or do you guys really say like keep them out of the room for X amount of days?
Yeah, so definitely I think it's just the same all around for both cats and dogs. I think keep them out of the room, don't like go home and snuggle with them at least 2 to 3 weeks while things are fresh. I know patients want to jump back into bed with their dogs, and this is when they really need their support, right? Because we're like restricting them, don't do this after surgery, don't do that. And so now it's a good time to
Mhm.
Netflix and chill with your animals. But everything is very everything is very fresh, and you don't want to run the risk, and we always want to be more risk adverse and be ahead of any risk. And so with that, it's just best to keep the pets out of the room, especially during sleeping hours, because they can jump on you. And actually what comes to mind is I had a patient, well, it's happened maybe a handful of times, but patients have said my cat just stormed through my drain that was hanging from my tummy tuck. And that is just like one of the reasons why I stay away from the animals, because that is very painful. And then they come back, you have to put a new drain in. And so it's
Oh
not
my
fun to
gosh.
start from beginning or the start.
No, and they chew on things too, cats
Mhm.
will I had a cat way back in the day when we had landlines, and my husband was talking to a call, this very important call from Germany, and it was this whole thing. In the middle of the call, the cat, Coco, all of a sudden the call disconnected, and we found out she had chewed through the phone cord. So it was like, but,
Yeah.
then on a drain, that'd be, like, super tempting for a cat
Yeah, they,
or
like, think the
or any
bulbs are
kind of
toys because 'cause they're just
uh-huh.
hanging, and then they just think, "Let me just run right through the drain." And then, their claws or even dogs, like, their paws can get stuck onto a garment, and it's painful.
Oh,
So,
true,
you're
true.
already kind of going through this recovery period, like, don't add to it. Don't take the
Right.
risk.
Now, what's something else that maybe patients don't prepare for at home that ends up being, or could end up being a big deal during recovery?
So, I would say, patients don't really plan for their bowel movements because anesthesia
Mm,
is not fun when it comes to a bowel movement. It takes a while, it takes a few days to really wake up the bowels. And so I would say, like, you can do something as simple as Miralax, but then if you're really constipated in the next few days, you could even do like a Dulcolax suppository. You want to try that because it's uncomfortable. You're already
right.
uncomfortable and moody from surgery sometimes, and so then to add that to the mix is just be efficient with all of your planning. And so I would say definitely plan for the bowel movement, and hydration. Definitely hydration. Stock up on your water, stock up on your electrolytes. And I'm trying to think if there was something else. Meal prepping. Meal
Mm,
prepping is a huge help. Like, make sure you have high protein, high fiber, and just overall good nutrients that are going to get you through the days. So you need the energy. You also need to sleep well, and like I said, you need to have the bowel movement. So those are just a few things that come to
yeah.
mind.
Well, I think the 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 bowel movement topic, like, people don't assume like, they don't really know, and part of it's, like you say, the anesthesia, the painkillers, all of those kind of stop you up. You're maybe not drinking and being as hydrated as you need to be, and
Mhm.
also you just don't have the motility, like, your movement when you're walking around the house, and the more movement you do, that gets things going. Well,
Mhm.
the first couple days, you're maybe not as mobile as you would normally be. And then everything slows down. It's like when people talk about when they travel and like, why is it every time I take a plane ride and I go on a trip that everything becomes irregular? Well, it's because you're
Mhm.
like, you might have been on a plane for 8 hours and things aren't normal.
Mhm.
And so I think that's great advice to just sort of think, okay, what are the things I'm going to need? Because you don't want to be especially having surgery, whether it's your face or your body, like bearing down and pushing that
Mhm.
raises your blood pressure, and that's not good. Um,
Exactly.
so what is maybe something that patients think is gonna be helpful during surgery, but maybe it really isn't that helpful?
Um, Planning to clean the closet, that's never helpful. Um, Doing laundry, and it's doing laundry, and I say it of like, "Oh, I'm just gonna sit here and fold the clothes." But that's the thing, it's
Mm,
like repetitive motion. Like, you folded one load and now you've got 3 more, and patients also don't realize that after anesthesia and surgery, like, you're just tired. And so
mm,
what you would normally do in your day-to-day could feel like you are working at it for 3 days straight. So just a simple task as, like, folding laundry. So I would say anything that with repetitive motion, and also rearranging your cabinets. It's like, I'm just gonna move these dishes over to this cabinet, or rearranging the bathroom drawers. Like, I'm not really doing much. I'm just standing here moving things side to side. But again, it's
mhm.
repetitive motion. So all of those household like chores that you thought you can wait to do for when you have just some more time in the house, those are the things you don't want to do. You want to
Yeah.
protect your investment.
Well, and you could be sabotaging your recovery without even really realizing it. You're thinking,
Mm-hmm.
oh, I mean, I think all of us there's always those projects, those back burner projects that you're like, oh, I'll get around to that sometime. And you want to be
Mm-hmm.
efficient, right?
Yeah,
So
like, "This is my
you're at
time
home
off.
and
What do you mean? I took 2 weeks off work. This is perfect timing." And it's just not.
well, and it's like you pay all this money, you take all this time, you do all this prep, and you don't want to undo it with some silly thing, right?
Mhm,
It's like,
mhm.
don't be tempted. And you think you feel well. And I know because I have a family member who's not going to be named, who's a Dr. Swiston patient who went on a walk and she shouldn't have. And I told her not to. And Dr. Swiston told her not to. And you told her not to.
Yep,
She
I am
did it
also,
anyway.
but I'm speaking from experience too, because when I had surgery, it was right around, 2-week window of my daughter's birthday, and I'm gonna go to the zoo. This is perfect. We're
Oh,
just
the zoo.
walking. We're just
All the
walking,
hills at the zoo.
and all of the hills, and there I was back in the OR with a hematoma. So, take advice from someone that's been there, done it. Like, it's not worth
Mhm.
it. It's not worth to
Yeah.
start over, and you want to be safe about it. And this is something that, like you said, you've put the time into it. It's an investment for yourself, and so you deserve to take some time to rest. And you'll get to the finish line. You've got to take care of yourself first.
Mhm. Now, do you have any like random or quirky tips or something you swear by that wouldn't maybe be obvious or show up in the standard post-op instructions or like or a hack?
So I would say like pregnancy pillows, wedge pillows, where there's these wedge pillows where you can, if patient has BBL, or even any fat transfer to the lower extremities. So there's a wedge pillow where you can literally just place it at the side of your hips. And so it takes all the pressure off of the area that you fat grafted on that same area and on the opposite side too. And you're still able to sleep on your side. So
Mm.
those are really helpful. Pregnancy pillows are helpful because we tell patients don't sleep on your side. So it helps kind of position you better. I would also say like boxer briefs for patients that have had tummy tuck. It sounds so silly,
Oh.
but I've told our patients, just pick up some boxer briefs, like those disposable ones. You're not gonna care what they
Right.
look like, how they're comfortable. Your drain is oozing on it, so it doesn't matter.
Yeah, you don't care.
They're not your nice underwear. Who cares? Um, and then they kind of, apply a little bit more compression and over the abdominal area. So it's like perfect. It goes right over the binder or it goes right over the garment. So a little bit more compression without it being too snug is perfect. The other one I would say, and I forget the name of this all the time, but we've all been there, all done it, all of us that have kids. But after pregnancy, you have those squeezy bottles that you can fill with water and you just use them to wash.
Oh, yeah. I know what you're talking
Yes.
about.
Those are perfect. I tell all of our patients that are having any body contouring, because they can't really shower or bathe,
Yeah.
before the
But
drains
you
are
wanna
out.
be clean. Yeah.
Exactly. So taking one of those, soap and water, rinsing rinsing the areas is perfect. So
Mhm.
those are some helpful tricks.
Yeah, especially if you have, it's like sometimes you have a shower where it has like the detachable
Mhm. The
little washer
handheld.
thingy, the handheld
Exactly.
thing where it could be on, very lightly, not strong, but but if you don't have one of those, that's a really good idea. Really good
Mhm.
idea. And
Mhm.
and would you say like having a friend to help you is, I know you have to have somebody with you for 24 hours, but where kind of in the post-op experience is it good to have like your friend help with certain things? Like getting you up maybe or helping
Yeah,
in the
I would
shower?
say, like, the first 3 days. Beyond that, like, as long as you have some meals made, you have an alarm set on for your prescriptions, but everyone is different. I would say, like, the first 3 days, you should absolutely have someone with you until you kinda get the hang and the rhythm of, like, what does this look like, in your
Mhm.
day-to-day, when you're gonna eat, is everything kind of accessible in the home without having to reach really high above shoulders or kinda behind the back, so as long as the home is prepared and set up, I really don't think, having someone 24 hours, all day, every day beyond the 3 days, I think a friend or a family member popping in twice a week is perfect.
Mhm. Now, if you're going into surgery, you think you've done all the prep and you've bought all the things, is there always something one last thing they might be forgetting?
I would say their prescriptions. So it's always helpful.
Seriously?
Yeah. Helpful to bring the prescription so that our PACU and recovery nurses can cover exactly what they're going to take when they get home. And just the person that's going to be picking them up from surgery has a better understanding when it's like visually and right in front of them. So going through the steps of the medications, and the second part to it is just the emotional roller coaster of surgery. Is just being nice to yourself. Like give yourself some grace. Remind yourself before you go under, you're probably not gonna feel that great when you wake up, and that's okay. And
Mhm.
you don't have to know it all when you wake up. Like you don't have to know exactly what's gonna happen as soon as I leave here. Like that is not for you to worry about. That's for your caretaker to take care of. Um, and just know that the next few days are not going to be so fun. You're gonna be tired, you're gonna have to give yourself some grace, and you're gonna have to be okay with just resting. So definitely the emotional roller coaster of it. And I say emotional roller coaster for anyone that's doing elective surgery or surgery that isn't elective, going under and preparing to have these restrictions of you're going to have some downtime, you can't do this, you can't do that. That is an emotional roller coaster in itself. And so,
Mm. Yeah, that's a good point.
mhm.
Are there any like myths or assumptions that patients have that you want to like set the record straight about?
That when you wake up, that's your final result. That is what it
Mm.
looks like. So patients sometimes can get a little impatient with how things are settling, and just know that it takes time for tissues to settle and remodel. It takes time for swelling to resolve. It takes at 3 it just depends on the procedure that you're having, but around 3 weeks, you have an idea of what things are gonna look and feel like, even more so at 6 to 8 weeks where majority of the swelling has resolved about 80% or so, but then you've still got the 6 months to a year to really have that final result. But then also scars are another side of things that patients are like, as soon as they see a scar, it's like, "Oh, is this what it's gonna look like?" But no, scars have to break down. Your body's gonna do all the natural healing. You have to give them a year before you really judge the scars.
Yeah, that is so true, and it's crazy how much they change and you forget too. So like you forget even sometimes what you look like before surgery. You're like, "Oh, but I haven't changed that much," or this, but like, oh, when you see your side by side. So it's good to
Yes.
take some little progress photos,
Mhm.
because then
Mhm.
you're like, "Oh, wow, I really have come a long way." Because I
Mhm.
think you lose perspective. And maybe it's because you're in the middle of it all. And like you say, your brain's a little crazy, your emotions are crazy, and your body's busy healing.
Mhm.
So maybe less reinforcements are going to your brain and more are going to that area
Mhm.
it's trying to heal. And you're like a little loony for a couple days. And so, but like you say, giving grace, I think that's a great way to put it. Giving yourself grace, giving yourself time to heal, knowing that we've all been there, and that's where I think having the support of the staff and the surgeons, like really almost all of us have had something done at one time or another, or more things than just one thing. And
Mhm.
we can all say from our own point of view what we felt like, or what, oh gosh, you're going to feel this way, but trust me, it's going to pass. And like that quintessential feeling that I think every surgery patient goes through is like the next day, they're like, "Why did I do this? I was
Mhm.
fine yesterday. I was fine yesterday. What
Mhm.
in the world was I thinking? Why did I do this?" Totally normal.
Yeah.
Everybody
Yeah, and then you get to
everybody
the
has
6 to
this.
8 weeks and you're like, "Let's do it again."
It's so
Let's do it
funny,
again.
and it's just like clockwork. Everybody feels that way, and so whatever's
Mhm.
going on inside, know that it's normal and okay. And I think, you have that pre-op visit about 2 weeks before surgery, and your nurse goes through everything with you, and it's a lot, and we give you a whole book to take home. So it's
Yeah.
like you have your little booklet, and it's gonna walk you through, but that thing's really helpful because, when you're pre-op, you're not digesting that first 24 hours, what that's gonna be like. But when you're in the middle of the first 24 hours or the next 48, that you can look at the book. Oh yeah. Okay. And refresh your memory. That's super helpful.
Yeah.
And I would say my biggest piece of advice, I mean, I have lots of them, but one of them is having a sheet with all your meds, and
Yes.
especially if you have drains. So my meds, and this one's every 4 to 6 hours, or this one's this much, and ticking off because you think you're going to remember and you don't. Or like, oh, the drains, okay, I did them at this time and here's how much. I mean, so having a little chart, even if it's hand drawn or we give you a piece of paper, and with where you're going to record all this information because like I say, you think you're going to remember and you don't. And so you're like, oh, wait, which pill did I take? The Keflex? Did I, you just don't
Which
know.
is what?
And so,
Yeah.
right. So I think having, and just having that by your bed, and I think that's a really important thing to do because of course your helper's going to be helping you do that, but then at some point you're going to take over.
Yeah, you're going to be
And
doing it yourself. And we give patients the drain log and the medication log. But I would say the third thing that's really helpful is just setting an alarm for those medications. But yeah, that was my last note there, is just to set alarms for those medications. You can't, there's no way you can forget.
That's right. It's just going to bing at you. And yeah, well, thanks, Kayla. This was so interesting. And we'll put in the show notes the links to some of the things we talked about. Like, let's get some of those links to the special pillows you were talking about, or wedges and some of that, if you have them, if you can think of it. And then we'll put a link to the story about the guy with the dog, which makes me so sad. But he's like, what a trooper. And he really, he got himself through it. But one thing he said, he's like, I thought I had the flu. He didn't think he didn't feel well. He thought he had the flu, and it wasn't that. So always pay attention to your body, call your nurse. And so anyway, well, thanks, Kayla. This was super informative. And everybody in the audience, thanks for listening. We hope you subscribe. And if you subscribe, you just have to show us, come into the office, and we'll give you $25 off of any product of 50 or more. So that's kind of a nice little treat. And we thank you all for listening, and we'll see you on the next one.
Thank you.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.